In tonight's Health Edge, a look at obese teens going under the knife to lose weight. More than 228 teens studied, many starting out weighing more than 300 pounds.
Boy, this is hard to believe. Chief Health Editor Dr. Partha Nandi joins us now with the pros and cons, and I had no idea so many teens are going under the knife.
Well, it's an epidemic. You know, when we travel outside the United States, you realize that not every country has the same problem we do. This is an epidemic. So here's the thing. The pros are what they're talking about. You lose all this weight, and then down the line, you reduce the complication of obesity, hypertension, diabetes, all the rest of it. But I want to, people are looking at this, I want to really stress the fact that this is not, panacea, meaning that we shouldn't have all the teens go out there and go under the knife. The important thing is that if you're the right candidate, which means that if you reach a certain weight, body mass index.
You have to be at least 100 pounds overweight, correct?
At least that. But the other thing is that you've actually tried diet, you've tried counseling, because they've showed in some studies that you can get similar results if you actually work out, which is exercise, go on a diet, and also go through counseling. So it's important that it's a specific type of patient we're talking about that gets these results. But it's really encouraging because folks who've done that have no choices until now.
So we see the Kylie Jenners, this is what they're seeing, and the alleged plastic surgery that these teenagers are getting now. There has to be some kind of age limit because they're still growing.
They are, absolutely.
Okay.
But even if you're a teenager, the thing you have to think about is risk is that, listen, they're still under the knife, so they can get complications of what? Blood clots, they can get complications of having problems under anesthesia, they can get infections, and people still die from these surgeries. So it's not like, oh, I've lost all this weight. And one of the things in the studies when I read, which has really disturbed me, is that the teenager said that she met her goal of achieving this size jeans. That is not the goal for me.
Right.
For me, the goal is about health care. It's about achieving better health. And we have to know as parents, that's the actual goal.
You got to get all the information and weigh the pros and cons.
Exactly, and talk to your doctor.
So let's talk about the cosmetic surgery with the most risk out of all of them.
What's your guess?
Liposuction.
Yeah, so it's tummy tucks.
Oh,
so tummy tucks,
not too far
number
off.
one. Yeah, not too far away. But the thing is that because you're going under the the anesthesia and the complications that come with it, especially if you're doing other surgeries along with it. So people say, doc, and I've actually had patients tell me that I'm going to have X, Y, and Z surgery. Can they just put a tummy tuck in there? Because I want to look my best, and people can die from that. So remember that before you ask your doctor to just add it on like it's an extra fry with your combination meal. It's not the same. That each surgery you do actually adds risk, and we should be informed and really tell our doctor, listen, I'm thinking about this. What are the risks? And this is one of the
and
highest
why
risks.
that's so serious. I mean, we had a beloved doctor here in town.
I know that doctor
exactly
very
who went
well.
under the knife.
It was a huge loss in our community, and because of that very reason. So we're not immune from that. But the idea is that it's not just an add-on. It's not a simple thing. People joke about it. You hear it on reality television. I'm going to get me a tummy tuck because I'm got a roll going on. Well, guess what? It can kill you. So before you do that, get the facts.
Absolutely.
Serious surgery. All right. Thanks a lot, Doc.
It's my pleasure. Have a good weekend.
And if you have a question or health concern for Dr. Nandi, you can email him, drnandi@WXYZ.com, or send it to us on Facebook or Twitter.
All new at 5.